We
All
made it.
right, we made it.
Karen.
Hi, everyone. Welcome to our live. So I'm Dr. Karen Tangs, Dr. Nighat Arif, and my UK counterpart, and we're excited to have everybody join us again today. So much to talk about this time around. Plenty of topics to dissect in terms of the world of reproductive health. So how have you been doing before we jump into all the meaty stuff?
I've been good. I went and did a special recording on the weekend in Belfast, Northern Ireland, to talk about and unpack the science of the menopause with Professor Joyce Harper, who's a professor and researching female reproductive health and menopause, and is setting up the menopause school for free education, which is part of the Women's Health Strategy, as you know, that we're working on in the UK. And she's a professor at the University College London. So me and her flew over to meet the BBC World Service team. And there was also Professor Lynette from the US, who has been looking at the bioculture of the menopause. And it was fascinating because she's done a lot of anthropologic, I can't say that word, work in and around the world, looking at different cultures and the perceptions. So particularly looking at Japanese culture, whereas koniki is what they would use to describe menopause, which is the word which basically is means regeneration, new birth, and coming to terms. It's like a seasonal change that happens. So it's such a positive preparation for in Japanese women around menopause actually starts in their 30s and 40s, where they're really and phytoestrogens, tofu, exercise, tai chi, strengthening exercises, and these women are sort of prepared. They generationally, women talk about it at home. On the flip side, when you come over to the Western culture, it's so negative. Though it's all about sort of stopping down, slowing. And then if you look at sort of Sudanese culture or Arab cultures, the literal translation for the word menopause is the age of despair. If you look at South Asian communities, being a South Asian doctor, we don't even have a word for the menopause. It's something that's so taboo that we don't have a direct translation for the word menopause. It's derogatory words like you're off the rag or now you're barren, banji. So it was fascinating unpicking this for a global World Service audience. It was a radio show, and it's listened to over listeners across the globe, and it was just such a blast. Myself and Joyce had so much fun, so I've been doing that, and then working with Kira Matthews, the BBC reporter here for BBC News, looking at Elon Musk. Our friend has put a cat amongst the pigeons. And then
get ready, everyone. We're jumping in. We're diving
in. We're going to jump into that. And then finally, we are looking a lot in this country about at-home self-testing. So I don't know what's happening in the US, but in the UK, there's been a rise in like check your vaginal health and vaginal things and put this test up you, and it will look at your there is look at for your lactobacilli, and it doesn't mean anything. So there's a lot of social media conversations happening about self-testing kits, but actually when the patient tests themselves, their access is the NHS, and we don't have the services to say, okay, this is what you need to do. And also a lot of your vaginal flora is normal, like that. Just leave it alone.
Lactobacillus is supposed to be there. Yeah,
it's to be there. Don't touch it. Leave it alone. So that's what I've been working on. And yourself, what have you been up to? Because you've been
you always are up to so much more interesting things than I am. So, while you're kind of talking like global women's health, like I am actually just starting my own practice. So this is something that I've talked about just like a little bit on my accounts, but starting next month, I'm going to be opening my own solo, just me practice. I'm very excited about it. I'm really happy to be able to practice the way that I feel like patients deserve, to give them the time that they deserve. But it's nerve-wracking. I think, when we train as doctors, we don't learn anything about what it is to like start a practice. I think we're so just, mired in all of the day-to-day work that we don't actually know what it takes. And I really give kudos to all the people out there who are entrepreneurs and business people who really have done something on their own like this, because it takes a lot of work and it's been really crazy. But in the meantime, I entertain myself with trying to address all of the misinformation that's going out. Like literally every day something pops up. So let's dive into the Elon Musk thing, because I think, since you brought it up, for those who don't know, Elon Musk, for whatever reason, tweeted about a week ago saying that birth control makes you fat and makes you depressed and increases suicide rates. Now, the background of this is apparently he, for whatever reason, feels like the world needs to be more populated. So a lot of people kind of took up this tweet and were like, look at this, birth control is terrible. It really made me depressed. How wonderful it is that he's championing this. But the subtext is he's not championing anyone. He's not like, oh, let me lift up women. Like, he's basically saying you all should get pregnant. And pregnancy, like, the final word is that pregnancy has infinitely more risk than any birth control. Like, I always tell people, like, if you're concerned about the side effects of birth control, potential like mood changes, weight gain, blood clots, pregnancy has those risks many-fold higher risk, like sometimes order of magnitude higher risk. So, if you come down to it, you always have to balance the risk of birth control with the risk of pregnancy. If you were to come off of reliable birth control and have an unintended pregnancy, not only the social issues of, what do you do with that now, especially now that reproductive rights are being, so scaled back, to put it nicely, in the US, what would you do? And, the alternatives of non-hormonal birth controls also have risks and benefits. Some of them are definitely not as effective for preventing pregnancy. Some of them have their own, risks as well. So you always have to balance anything that you hear. Like, if you hear something on social media and you're like, it's scary, it's going to hurt you, you always have to balance it against the risk of the alternative. So I always tell patients this, it's not just like in a vacuum. It's like, what would happen if you stopped taking your birth control? Would you get pregnant? Would you have then the PMDD that you were suppressing with your birth control, or the painful, heavy periods that you were suppressing with birth control?
You have to always look outside the box of somebody like Elon Musk, who is able to use his platform. Number one, his platform is uncontended. So he can put out anything, and he has the means and the tools to amplify that, right? So he can put that out there to say birth control makes you fat. So let's just look at the first thing. The first thing he said, that birth controls makes you fat. And as you say, if you look at the alternative, getting pregnant makes you fat. I'm sorry, I'm just going to put it out there. There's two women on this live. Both of us have had children. Did you get fat when you had babies?
Of course. Yeah.
Yeah.
That's what
I
happens.
I, I got fat. Then the other
Weight
thing
gain is a part of pregnancy. Yeah.
weight gain is part of pregnancy. I'm sorry to break it to everybody, but it is. And then your body adjusts to that. Then the next thing is that of his tweet, he said that it doubles your risk of depression and triples your risk of suicide. And then finally, the sort of the nail in the coffin was know about this and yet not doing anything about it. And I think that that sort of conspiracy theory, so if you see something that says, look, they're all in on the game, but they're not telling you, that's rubbish. Look, when none of us are trying to hide any of the facts. So in 2014 and 2019, the Cochrane meta-analysis research was done, and it showed the all the studies that have ever been done on the hormonal contraceptive. So they looked at the combined oral contraceptive and the progesterone only contraceptive. Now, the hormonal contraceptive goes beyond that. We know that there's the implant as well. There's the injection, which is a Nexaplan. You also have the vaginal ring, which also gives you estrogen and progesterone. You have the combined estrogen and progesterone patch. And then also you go into the intrauterine system coils, such as the Mirena coil, Kylena. There's a whole load of different coils that we have for different reasons why we need them. So the tools that we use when it comes to hormonal contraceptives are wide and huge as well. And all of them have completely different risks and benefits. So if you're looking at the combined oral contraceptive in comparison, say, to the progesterone only pill, which is sometimes termed as the mini pill, well, actually, your risk of clots decreases, hence why we give that to those patients who are at high risk. Your risk of headaches and migraine decreases. There was a small mumbling about sort of cancer risk. Actually, your risk of cancer does not increase. And so your risk of mood-related symptoms, they will be variable. The meta-analysis from the Cochrane research actually conclusively on 2 occasions has come out to say your risk of, say, depression and suicide rate doesn't increase in regards to the background risk of a general population that we're looking because their risks are there anyway. And we know
Yeah.
that there's a social physiological model that can cause mental health disorders. The fact that you could increase those risks means that we do know that there's a population of women who have hormone sensitivities.
Mhm.
If we talk about PMDD, which you mentioned earlier, PMDD is a hormone sensitivity which causes neurological changes within the woman's brain at the time of her period, roughly about 5 to 10 days before her periods, in reaction to the decreasing of the estrogen. And this is backed up by multiple theories. So there's a multiple hormone sensitivity theory that we know about. And so when you've got a decrease in estrogen, we know it can change and affect neurological pathways. So how the synapses talk to each other. Hence why with PMDD, you get higher increased rates of mood related symptoms. So feeling depressed, angry, low mood, irritable, loss of confidence, brain fog. You can get physical symptoms like aches and pains and tenderness, and you can get breast tenderness as well. And we know that these women feel horrific just before their period. They're not on hormonal contraception at all. That's their own hormones making them feel that way, because we know that there are a group of women, about 20% out there, who are sensitive to hormones. So you've got to be really sensitive and critical about somebody who doesn't have your best interest at heart. Somebody like
Yeah.
Elon Musk, feel he
Yeah.
doesn't. He's not thinking about women. He's thinking about the fact that there is this sort of bigger issue that he has about, I would say, women's reproductive rights. So it's about control. I think it comes back to bigger people who have these organizations and platforms such as his, and having the control of women's bodies. And that is really actually more sinister and dangerous than saying to a woman, hormonal contraceptive makes you fat.
Exactly. And when you said that he made this comment about like the scientists are hiding things from you, where in reality, when you look at his statement, it's so unscientific. It's basically saying like all hormones. I mean, when you look at it, there's hundreds of types of birth control, and they all have different risk profiles. We don't think that every birth control is for every person, but there's like a nuanced discussion of data and research and things like that. The reason we do things, and I mentioned this in the post about this tweet, that we look at things like meta-analyses and randomized control trials, is that not every study is the same. So anybody can sort of, and this happens a lot, on social media, where people will like have a very inflammatory, like, look at this risk and this causes cancer and this is going to kill you, because they kind of cherry pick like one kind of scary fact from something that's like not a very good study. You can make almost any claim. You can find some study to kind of back up this claim in some way. And that's why it's so dangerous to kind of, one, like make it seem like there's a huge conspiracy, that doctors are hiding stuff, when in reality we're trying to have like a very like nuanced discussion. It's much less sexy to kind of be like, let's look at this meta-analysis than it is to be like, this is going to kill you and doctors are hiding the truth. We're always going to kind of like lose in the clickbait battle when it comes to that sort of headline. So it's so important for people to understand that it would be so amazing if everything was so straightforward as like that. But in reality, when you look at the really well done studies and big studies looking at as many people as you possibly can, that the risk of the depression and anxiety overall is not increased above what we call like the baseline. And people who have depression and anxiety will be more sensitive to those side effects, when you take them. And people can and do have side effects. We don't try to hide this. Like, people can have mood symptoms. It just means that in a population that overall there's not a major increased risk. And it's sort of balanced by the people who get better because of things like PMDD, where they actually feel less mood symptoms when they're on hormones. So that's why in a population, it might balance out. The people who do better, the people do worse. It doesn't mean that people sometimes don't have side effects. It just means that in a population, there's not a massive increased risk, like he's sort of saying.
Yeah, literally the side effects that are on the leaflets that come in with the medicine. So, this whole conspiracy theory is actually blown right out the water, because we write in the UK we have the MRHA, and obviously you have the FDA, and so you would be looking at all those side effects. Then you've also got to look at the fact that, okay, beyond contraception, we don't just use these hormonal contraceptives. I think it needs a rebrand just
Yeah.
for contraception,
Yeah.
as you we use it for EMDD, we use it for PCOS, we even use it for sort of dysmenorrhea, so painful
Mhm.
periods, menorrhagia, heavy pain, heavy periods as well. We use it for the
Mm-hmm.
management of the symptoms of endometriosis, adenomyosis. So the benefit is actually beyond just that limited view. And
Mm-hmm.
the cynic in me, and I'm not that cynical, I'm usually quite smiley. The cynic is like, fine, Elon Musk, you put out a tweet that said it makes you depressed and makes you suicidal and makes you fat. Okay, let's take that at face value. What are the alternatives for male contraception? Can you
Oh,
see
give me
that?
free.
So the issue that we have is that he never balanced it out by saying, right, but actually, men, come on board and let's talk about what your role is in family planning.
Yeah. I actually said this in my video that if he actually cared, he would be putting some of his billions of dollars in creating a male birth control. If like the point was to be like, oh, women are suffering, this is unjust, like they shouldn't have to suffer like this. He would be like, let's create a birth control that's reliable for men. And what's ironic, and people have pointed this out, is that, all of the male birth controls that have kind of like tried to come on the market have, never kind of made it through because they're like, oh, there's too many side effects. Like,
Yeah. So I mean,
like, oh, men can't, we can't make them go through the side effects. But and people do make a good point. Like some of the discussions have been really, thoughtful in that, is it, a sad thing that we do use birth control, medications for so many different treatments? Yes, like we definitely need way more research and way more like options that we can kind of tailor to the different, types of conditions like the PCOS and PMDD. It is really telling that we have so few treatments that are good and evidence-based because there's just not enough research and like investment in some of those technologies. So that's definitely true. I do feel like we could do better as a medical system in creating better alternatives so that there can be more tailoring. But for now, people do have a lot of benefit in a lot of situations. So we always have to counsel, these are the pluses, these are the minuses, these are all the alternatives. And that's what's missing from these inflammatory posts, is that nuance and talking about, what are the risks and benefits of the alternatives.
If you look at the data, so I did a video about the fact that why there is no male contraceptive, hormonal contraceptive market. Yes, we have condoms, but get this, the biggest consumers or purchasers of condoms are still women, and
Mm,
compliance is low. So men don't like to use condoms. So in the UK, the BBC did a report just off the back of the pandemic, and we looked at consumption, but purchasing of condoms. And femidoms are very little known about, and then there's a smaller market for that. For condoms, they're available free in the UK
mm,
at health centres. Women will pick them up, but actually, we are finding that the men aren't specifically using them or using them for the purpose of, say, prevention of pregnancy. They will think about it mostly around the that this is probably an STD reduction.
interesting.
But what we have found is that off the back of the pandemic, because our public health messaging has gone to the wayside because of the pandemic, we're seeing an increased rise in things like syphilis, and we've got something called
Hmm.
that's come around. We've seeing high rises in chlamydia, which I definitely am seeing in my clinical practice. So that the one thing that we made for men, which is condoms, they have some responsibility and accountability. Well, that's not being used
Yeah.
appropriately in our, because public health messages are still, and the data is still showing that the use of the rise in syphilis. Then the second thing is vasectomies, right?
Hmm.
I looked at the World Health Organization data for vasectomies, and only 1 to 2% globally of the developed countries where you have access to vasectomy, because access is an issue, 1 to 2% of uptake of vasectomies. And in the UK, 63% reduction in
Oh, wow.
and you can get a vasectomy on the NHS in the UK. Yes, we have an issue with access, and there is a wait list available for it as well. But you can get it for free if you wanted to. And then finally, if you look at hormonal contraceptive for male, why is the male contraceptive pill not on the market? And as you said earlier, it's because of side effects. There are three huge reasons. One is because the men just simply can't tolerate the side effects. And get the side effects right. Mood related and depression, about 2 to 3% of men get that, which we are like, but women get that as well when it's still on the market. Um,
Yeah.
Weight gain, but women get that too. Headaches, about 63% of the men said that they got headaches. Nausea, about 80% of the men said they felt nauseous when they
Oh, it's a
took the
lot.
pill. That's a lot. But if you think about it, being pregnant, we have hyperemesis gravidum. Like literally, we are sick throughout our pregnancies. No one ever thinks about that. And then there were some men who said that they felt that they couldn't just, their erections weren't strong enough, etc. So the side effects are the thing that's putting off. Whereas the female pills, and we've got newer generation pills, the trials are still going on, and the side effects are minimalized. And in the original trial that was done for the pill, the combined oral contraceptive pill, 3 women died, and they never stopped the original pill trial in the 1950s. It stops men from ejaculating. So it's known as the clean pill. So you don't have any ejaculation, and it stops the, you still orgasm, but you just don't have an ejaculation. And the men don't like that because it's emasculating. And you're just like, almost all female contraception stops our periods, like mostly.
Or ovulation. Yeah, that's okay.
We never say we feel less
Uh,
feminine because we're not having a period. In fact, it's beneficial. But there is something about men, and to put it really bluntly, men and cum, that feel a pill that stops them from having ejaculate available.
wow.
Crazy. That's
Yeah.
the double.
Yeah. I mean, I hate to say it, but so many of these decisions about what medications exist comes down to money. Like, do they think that there's going to be a market for people buying this product? And if they're like, oh, men aren't going to like this because, they're not going to ejaculate, they're going to have, a little bit of a headache. If they think that there's not going to be people spending money on it, then they're like, why would we make this product and put the money into developing it? So it is really interesting to see the double standard of why, because there's so much more at stake for women, or people with a uterus who can get pregnant. They just are like, well, people who can get pregnant are going to put up with so much more because the stakes are on them, like for unintended pregnancy, whereas men are, like, like even just putting on a condom, like that small action is like too much, and most of the time it's the woman who is having to kind of produce the condom. That's kind of sad, but bigger discussion for
I
another
know.
day.
I said that it's in a way. I was like, do you know what, Elon Musk? At least you've rallied the scientific community together, because we're all sort of singing from the same hymn sheet, and
Yeah,
counteract that. You're not a doctor, so stop giving out medical advice. But also,
yeah,
when it comes
yeah.
to family, I thought that was significant. 2024, and the data shows that actually men don't play a huge role when it comes to family. Even if I look at my own cases, like I would say the
Mhm,
family down right down to me, and it's still at the foot of the door of the woman. And I wanted to sort
mhm.
of move slightly from this, because I know in the
Yeah,
US, bigger conversations about sort of
yes,
the responsibility at the foot of the door of the woman, and embryos being little children. That hasn't
yes.
come to the UK yet, so fill me in with that.
Yeah. So, for those of you who aren't in the U.S. and haven't heard, because it's been all over the news here in the U.S., the Supreme Court in Alabama, in a ruling, declared that embryos are children and protected under sort of like these, acts that protect children from, death. Basically, there was a case at a fertility clinic, which is very sad. Like, apparently another patient got into the clinic somehow and dropped a container containing other people's embryos, destroying them. So basically they're looking to see if they can charge this person with murder, with manslaughter or murder. And the court declared that yes, you can, because embryos are children. And when you look at the actual verbiage in the ruling, it is insane. Like, they so clearly were taking kind of like religious doctrine and using it. Like, they basically said that like these are, they called it extrauterine children, and that it was a nursery that they were being kept in, like that the extrauterine children in the nursery. I mean, it is wild when you look at this. It's like an actual like legal document, like from the Supreme Court of a state. And then the Chief Justice like literally like had a statement saying that like a just God, and I'm a Christian, but like it is so wild to see it just so clearly applied, like that the religious beliefs of the justices was being used to basically now take away access to IVF. What's happened is, obviously, if you say that an embryo is a child, and if, say, there's so many ramifications of that for people who provide IVF services, like if you, thaw, some embryos don't survive the thaw. Like, can, families then sue the doctor for manslaughter for killing their children? So obviously, in light of all of these questions that have been now raised, when you say that an embryo is a child and that if it dies, you're killing it, then, IVF services in the state have basically halted. So the biggest, medical organization there, UAB, University of Alabama, Birmingham, stopped IVF services basically cold turkey right as soon as that came out. Lots of families just in complete limbo, like who are about to start cycles or mid-cycle. Like, can you imagine like the amount of time and money and heartbreak that is kind of happening right now with those families? And then 2 other clinics, I think there's only like 5 providers of IVF in the state, and at least three at the last I heard, have stopped IVF altogether. And the concern is that, will they ever be able to resume it? Now, this is something that we saw kind of the writing on the wall as soon as Roe v. Wade fell. We knew that as soon as you start kind of saying that like life begins at fertilization, an embryo is a human being, that IVF and then also birth control were going to be on the chopping block. So there's a lot of misinformation about, IUDs causing abortion. They don't. Emergency birth control, it is not abortion. But there's enough confusion in the general public and apparently in legislators and politicians that those are all at risk. So, for instance, like the senior senator in Alabama, right after this happened, he was on camera in an interview, and people would be like, what do you think of this? He's like, oh, I'm all for it. I'm all for it. And they're like, well, what do you say about the fact that now IVF is completely like stopped in your state? He's like, oh, well, we have to think about that. I'm like, you do have to think about that. Like, you can't be all for something and not like, realize that there's ramifications. And he just kept saying this verbiage of we need more kids, like we need to have more babies. But you've now done something that took away people's ability to have babies, like, and they just don't realize that. And this is why, doctors in the US have been screaming this now since this case came out, is that this is the reason that like people who are not doctors don't get to make laws about cancer treatment, strokes, heart attacks. Like, how can they? They don't have the medical knowledge to know what the ramifications are. You can't just be like, well, I just don't think that chemotherapy is good. It has some bad stuff associated with it. No one should get chemotherapy. Like, we don't allow people to do that. And so somehow with reproductive rights, that goes out the window, and the beliefs of a few are imposed on the rights of everyone. So that's what's been going on with that.
For somebody on the outside, on the other side of the pond, sitting in the UK, that what you've just said to me is just horrifying as a clinician, but also as somebody who refers patients in for, say, IVF treatments, because we know that the demand is there. And also, as we're getting an aging population and so many other medical conditions that can affect your fertility now that we're realizing, means that that one option that that couple has to have a baby and be a family is going to be taken away. What concerns me is actually off the back, and you know what? It's interesting that you said off the back of Roe versus Wade, when that fell through, we exactly in the UK had these conversations as doctors because we were worried. Mm-hmm. Come over to our shores, and we've already got quite a few of very radicalized religious groups who do want to have complete annihilation of abortion in this country. Make it illegal, you can't have it, etc. And then also we have groups that are very much against even IVF, especially because if we look at it, because we're trying to really fight for LGBTQ plus rights. And so these couples rely on IVF treatments to be able to form a baby and stuff. So how do sort of the LGBTQ plus community access IVF in Alabama?
They don't. I mean, like I said, that actually, is not at all a concern. It probably would be something to be like, this is a great, plus to not allow like queer families to have children. I mean, the rhetoric is wild. It really is insane. And when you think about it, and it's so frightening. So, for instance, like a follower who works in a NICU, like a neonatal ICU, messaged me and was like, what does this mean for us when they have, sometimes people will have like a cervical insufficiency and they'll like give birth at like 15 weeks. You obviously don't try and resuscitate a 15-week. There's no way for it to survive. But now are they going to be charged with murder or manslaughter if they don't try and resuscitate this child? Like it has so many ramifications, and honestly, doctors, I'm sure, will leave states like this, because how can you continue to practice like this? I don't practice obstetrics, but things like miscarriage management. This happened in Ireland. The Savita Halep, I forgot her last name, but a woman who broke her water at 17 weeks and could not access abortion care until she was basically nearly dying, and then she unfortunately passed away because there's no lawmaker who can say, like, are you close enough to death that your doctor will not get prosecuted for a felony to because they help you. And I just cannot imagine like practicing medicine like that to help someone in the ER. Like, in our minds, of course, if someone has premature rupture membranes, it's pre-viable, like she wants the option to terminate the pregnancy before she gets really, really sick. But who gets to decide how sick enough they have to be before it's life threatening? Like, when they have a fever, when they have some pain, when they're in the ICU, like, how close is close enough to death? And so it's really going to affect access to care, because a lot of doctors, I'm sure, will be scared and like leave medicine. They may close OBGYN practices. They, almost certainly are probably going to close some fertility practices. So, the ramifications of this are really massive. And I think people did not realize this. A lot of people with the IVF were suddenly had their eyes open, like, whoa, IVF is a good thing. But like you said, there's enough extremists who are like, well, any fertilized egg, we have to, keep people from discarding those. And that means taking away all IVF, then so be it. So, yeah, so it's a heavy time.
It's a really, because I'm just thinking that, in more than just doctors closing clinics, it's a skill. And if you're going to scare doctors to go into that field of obstetrics or fertility treatment, then that's
Yeah.
horrific. Where do we get fresh blood?
Yeah.
Because at some point, even you and I are going to leave this rock and not be around, and our skills are going to go with us. And if we've got nobody else to pass those on to, then we're going to go backwards. I feel like 2024, or actually, since the pandemic, with reproductive rights and who controls women's bodies, and it definitely feels like women don't have control over their own reproductive rights. We're going backwards, and that is the thing that's really scary, because we are desperately trying to counteract that and hold on to that. We have really great bodies, but obviously they could do more. So we do have faculties and colleges that are backed by making sure that there are doctors who are sitting at the decision table with politicians. So here we have quite a different way of doing things, and it's the fact that we have something called select committees, and these select committees, the politicians know nothing, and I can tell sat on a couple of select committees where I've had to give evidence. We've just recently had one about obesity, and one of our colleagues, Dr. Chris Van Tulken, went on there to talk about it. He's a doctor who specialises in obesity and high ultra processed foods, and he's written a book, and etc. etc. So, the way it works with our lawmakers in this country is that they always have round tables where clinicians and experts from those fields come, and they provide what they're seeing on the ground and the research that they're doing, and then they get full access to what laws are going to be made. So I've got something to end this talk on, talking embryology and fertility and things, and talking about miscarriage as well, because we know that miscarriage happen for a very long time in England. When babies passed away, so either you miscarried at, say, before 24 weeks, then we never counted that and had any way of registering that that was a child and that was a baby, because that was to somebody. Even at 12 weeks, we just don't have any documentation to give to the parents. They just say, they had a baby that passed away. But for some, say it's not just one, say it's like 8 or 9 that passed away before 24 weeks. So the incredible campaigners have worked so hard, celebrities as well. And now you can get a death certificate, a sort of a certificate that can be handed to you to say that you've had this type of miscarriage, a miscarriage, or you've had this kind of a pregnancy at this stages, and it just ended, to take away with you, and it's documented, and they're part of the archives. So even your baby that you were much hopefully trying to get at 16 weeks, or was, and you had an unstable cervix, and and you delivered at 16 weeks will be recognized as it, as something that's part of the archives in the UK, which I think is really groundbreaking, because we're thinking beyond the fact that this is just a clump of cells, which can be, because I think you can be extreme in that, but also it gives parents closure, because I don't think some parents get closure, and that's so significant to be able to recognize that all these pregnancies that they've had, and for too long women have had, say, 4 or 5 pregnancies, and then when they go to the doctor, the only other pregnancy that's ever recognized is the live one.
Mhm.
And I make it always a huge part of my consult. Even when I do menopause consultations, I take a full gynae history. So, as I'm sure you do, and you
Mhm.
ask, miscarriages did you have? How many live births? Were there any complications? And now that there is something that parents can have, I think that's really great news. And we're really, really proud of that as doctors, to be able to get recognition and closure for parents who hurt
Mhm.
a lot. Something tragic as a miscarriage happens.
Yeah. And I've said this a lot to you kind of off camera, but I do admire that in the UK, because it is a smaller system, that they do seem to kind of take the input of doctors and experts and advocates, like patient advocates, much more into consideration. Like, obviously no system is perfect. I'm sure they're not going to like take everything you say verbatim and make it into a law, but at least you get that seat at the table. Whereas like in the US, like, they're basically actively excluding doctors and like making laws that are completely counter to like standard of care, and we're basically out there on social media kind of screaming about why standard of care is the way that it is. And so at least there is that little bit of hope that you guys have that voice to make a difference. And so
where is the value of your medical degree or your specialism in the UK, in the US, sorry?
what do you mean? Sorry, just that it in relation to the government or like
Yeah, if they're
they don't
excluding.
care. They don't care. I mean, so, and then we'll need to wrap up a little bit, but like, so to give an example, the Florida, like the Surgeon General of Florida is very extreme anti-vaccine. And he was chosen for that reason. So basically there's a measles outbreak right now, and he is actively saying, don't worry about vaccinating your kids, like don't worry about sending your kids to school if they have measles. I mean, it's complete, like I said, completely opposite to any sort of expert guidance. But they chose someone because of his political position, and that's what's going on in Florida. So, like it's really horrible. It truly has become where political opinions and trying to kind of win kind of quick points in a political system has completely overridden any sort of like evidence-based like guidance, like some sort of neutral position from medical experts or expert bodies. So, not wanting to end on a completely like depressing note, I wanted to end on your like very positive note, but just that's the point. Um, but I do kind of I have some hope in that the recent Alabama situation with the embryos at least really galvanized both
Yeah.
doctors, the media, like patient advocates, just to kind of speak out, because for so long it was just that like whoever was loudest kind of made the rules. So I think now people are starting to kind of say like this is completely unacceptable, like we have to speak out. So at least it's sad that it took something like that to kind of get people out of their comfort zone to speak, but hopefully we'll continue doing that. So, and us having these lives, I think hopefully will help as well. But let's kind of wrap up. I was about to say, do you want to have any last like kind of just like positive things or like thoughts you want to leave us with?
I think that definitely the fact that all these taboo conversations about IVF and male contraception and responsibility, at least it brings it out into the open. And I suppose, yeah, it rallies the doctors together and the scientists, who it's literally our bread and butter to say no, this is wrong, and we need to galvanize together. And I do feel that now there's a position that we're coming to where doctors from across the world and globally, we're not just in our entity, but we are thinking about the global health as a whole. So I learned
Mhm.
so much from you, and I hope you learned something from. I don't know whether you do, but
Yeah.
it means that we are sharing information for the betterment of our clinical practice, but also what it comes down to is the safety and the care of our patients, and providing them the best adequate care that we possibly can.
Yeah.
So we're here every twice weekly. No,
Every other
every
week,
night.
every
Gosh,
fortnight. I love that.
every fortnight. And yeah, I hope this has been great. Thank you so much. You've educated me so
Thank you,
much.
everybody. And just really quick, like, because your point in the very beginning about kind of a global approach, I just want to say, because the first time we did the live, we noticed we had such a global audience, like the people from every, like, so many different countries, like different continents. And I do love this, that we do get a bigger viewpoint of the world, different ways that people think about health and bodies. And I do think this is wonderful. And I really love that we're doing this. So thank you, everybody, for joining us. For those of you joining us on the recording, hopefully next time, if you can join us while we're live. And we always love getting your questions. So let us know if there's any questions you want us to answer or address in our live. So thanks, everybody. Have a great week.
Bye-bye.
Right. Bye. Let's see if I can I end this?